What I'm trying to capture at a Refugee Week is a little bit of heart and soul and memory for why people become doctors. And that most of us who went into medical school did it with the concept that we want to make life a little bit better for people in need. We want to help others. And I really think people mean that. I often think that the medical educational process, medical school and residency included, might take a little bit of that out of you. The work is becoming harder, and the duties are becoming more detailed, and the number of hours that anybody can work, at least on a trainee level, is being cut back. And so everybody's working really, really hard. They need to be efficient, they need to be fast, they need to be super smart, as they say in Rhode Island, wicked smart. They need to be careful. But I often wonder if in the process they've gotten so smart and so efficient that they've stepped away from, for lack of a better phrase, the love. Ordinarily, residents spend a minimum of a half a day a week seeing a panel of patients. It's very hard work, the patients are very complex, and it's one of the times where they're both proud but frightened because it's so much to do. That half day that they would have come to see their 8 patients, we're going to say, you are going to be connected one-on, 2 or 3 residents, anywhere from 1 to perhaps a family of refugees, and with some guidance from us as their teachers to go through the process of actually asking the questions and communicating in a way that brings out the story of how they became refugees, how they survived, how they came here, the impact on their futures. Less so on your blood chemistries, with the true goal to hear how patients have something to tell us. We will be far better physicians and far better people if we're reminded a little bit about how fortunate we are to be physicians, how pleasurable it is to walk a path with somebody else, to get some perspective on our own lives, to feel like you've been meaningful to somebody else. And I'm very much hoping that in this week, as we actually take trainees and residents, we're going to open up an afternoon where ordinarily they would have been running as fast as they humanly could to see all the patients they could, and trying very hard to protect them from that in whatever way we can, to sit down with somebody who's come from Africa, Bhutan, Cambodia, and say, here's why I'm here. Here's what's been hard. Here's my story. Here's what I hope. Here's how you've been helpful to me. Here's what I would like to see from you. And actually take on the role of teacher rather than patient. And I'm hoping that people will walk away somewhat re-stimulated with, yeah, that's why I went into medicine.